We'll give them a couple minutes.
Okay, we are live on YouTube. They'll jump on when they can.
Okay. We'll call the meeting of the neighbors of Dunn County to order. This is the monthly meeting. Roll call. I see Supervisor McCulloch, Supervisor Jensen, Supervisor Kinnear, and County Board Chair Bartlett. Do not see Sarah, Supervisor Kennedy. The minutes, I'm sure all of you had a chance to look at the minutes. What's your pleasure with them?
Move to approve as presented.
Is there a second?
I'll second it.
Mike seconds, Kelly moved. Are there any additions or corrections? And hearing none, all those in favor say aye to approve.
Aye.
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 Same sign for nay, for against. Motion carries. Minutes are approved. Now we'll have Administrator Flunker's report.
All right, the first item on my report today is the report of the neighbors 2019 audit. So I will hand that over to April from Clifton, Larson and Allen.
Good morning, everybody. Can you hear me okay? Thumbs up? Okay, good. Well, you should have received in your informational packet 8 pages of the draft. We have a 10-year summary and then 7 pages of draft information from the financial statements. And so I will highlight some of the stuff mostly in the 10-year comparison, but provided the other pages as a reference or a little bit more detail to what we're going to go over. So to jump into things right away, you won't see it, but I'll just give a high-level overview as far as when we do the audit. We also have a governance communication, and that's where we report any findings as we go through the audit. And so in the final reports and communications that we have to you, you'll see that, and we will be reporting the 3 material weaknesses that we have historically reported, both for the neighbors and for the county as a whole. And those 3 items are the lack of segregation of duties, the drafting of the financial statements, and then audit adjustments, material audit adjustments. And so again, these are items we've reported in the past. I think most of you are familiar and probably well aware of what those findings consist of and why we have to report them. And so again, they're very common with the entities that we work with. I work specifically with governmental and quasi-governmental type entities throughout Northwest Wisconsin. And so it's very common due to the makeup and structure of the entities. We will be also reporting an unmodified audit opinion, it is called, and that is the highest audit opinion that you can receive. So that's what you're striving to achieve. It's considered a clean opinion, and it means that your financial statements are in accordance with generally accepted accounting principles and all the rules and regulations and standards that exist out there for you to follow. And so again, that's kind of the high level overview of the audit results. Does anybody have any questions before we do jump into some of the numbers? Certainly feel free to raise your hand and jump in if you do have any questions. So then we will get into the page 1 of the information that I sent. And as I said, that's a 10-year comparison. So you can kind of see how things have trended and changed over the last 10 years for just the neighbors. And so what I'd like to, this The top part is the balance sheet, or the statement of net position, as it's called in the financial statements. And so what you'll see here is a lot of changes at year end from year to year can simply be due to timing of things occurring. And so I won't hit on every line in this item, but I will just hit on some that you might see a bigger changes from last year or over the last couple of years. So first of all, you see that operating cash, the very top line. Last year, there was an amount there, and that was simply due to the sale of land that you had last year, and you wanted to keep those funds to pay for some expenses or towards debt this year for the neighbors. But otherwise, historically, NDC, as you can see, has not had cash available to it. And I'll get back to that as far as how you have survived is through cash flow loan from the general fund of the county. And so we'll see that down further in the liability section of this. Otherwise, in the asset section, that top section, the other thing I wanted to point out was the accounts receivable line. You'll see that's about 5 or 6 lines down. You'll see that increased to 1.8 million from 1.2 million last year. And again, that's due to a timing of when bills went out and then when that cash was received. So you provided the services in 2019, but due to staff transitions in the current year, those bills hadn't gone out yet, and the cash hadn't been received for those services provided. And so I would expect that next year that will declines as you get better collections and the billing process is down and transition to the new staff. So again, those were kind of the highlights on the assets that I wanted to point out. I guess one other thing that has had changes, it's been similar the last few years, but didn't have anything there a few years ago, was other assets and deferred outflows, the second to bottom line in the asset section. And that is due to accounting principle. GASB 68 is called, related to your participation in the Wisconsin retirement system. And I guess one other thing, that taxes receivable, you'll see that now it's been 5-6 years since you've had that tax levy put towards NDC from the county. So prior to that, you had received $500,000 for a couple of years and $750,000 back in 2010. So those are a few of the changes that we've seen in the last decade for NDC. So then when you get to the second section there, the liabilities, again, a lot of the changes from year to year can simply be due to timing. The fourth one down, the due to other funds, is that loan, that interfund loan that I talked about as far as the cash deficit. That 8.2 million then is the accumulated amount of cash that the general fund has loaned NDC for cash flows. And so you'll see that went up from last year, and that is a direct result of the change in net position or your income or loss for the year, which we'll get down to in just a couple minutes. So then a couple other items just in the liability section that I wanted to point out. Again, some of the things that have changed over the last few years that relate to some of those accounting principles and standards that have been implemented. But then what we get down to is your net position and that change in net position towards the bottom of the numbers here, the kind of middle section of the page. And so your change in net position for the year was a negative 1.4, almost 1.5 million. Excuse me. So what that means is that your expenses exceeded your revenues by that portion, by that 1.5 million. And so that's why you saw that due to other funds increase, because again, your income was less than your expenditures. And in previous years, I think we just have shown a net income loss for you. And so you'll see that in that bottom section. Now this year, we broke it out a little bit to provide a little more in-depth analysis of what that 1.5 million is made up of, that loss. And so you'll see that the top line, income from or loss from operations, you actually had income from operations, 200,000. So your revenues from your actual operations exceeded your expenditures, but then other things that flow into that overall 1.5 million loss include depreciation expense of 685,000, your interest expense that you're paying on the debt for the building at 558,000, and then back to those accounting standards, the change in pension and OPEB. There was a fluctuation there in that balance this year. And so that hit your income statement, affecting it by a negative $461,000. So that's what that 1.5 million is made up of. And you can see the page 3 of 8 that I sent, or it'll have page 5 on the bottom. That's your detailed income statement.
Excuse me.
Yep.
Mr. Can I have a question?
Yep.
Okay, this is Mike. We're still back on that change in pension or OPEB, and you say that's a change in accounting principles, or I don't quite understand that. It changed so much from the previous years.
So what this relates to is your participation in the Wisconsin retirement system. And a few years back in 2014 or 2015, basically every government had to bring on their proportionate share of either the liability that the state system has or the asset that the state system has. Wisconsin is a very unique situation that it's about 100% funded. So you actually brought on an asset back then, but sometimes it dips to a liability, like it might only be 96% funded. And so that is basically done, or it's NDC's proportionate share of Dunn County's share of that activity in the Wisconsin retirement system. And so again, it fluctuates. You really have no control over that because it's how the Wisconsin retirement system plan is operating and what their situation is. So again, that's why we kind of broke it out, because it's hard to really see the true results when there's those types of things in there. And so, yeah, back in 2015, as I said, you actually brought an asset onto the books at that point in time. And so even then it was a little deceiving because it was an increase, but you don't necessarily have access to those assets. It's just if the system goes under defunds, you shouldn't really have too much of a liability at that point in time because WRS is funded well.
Thank you. That was a good explanation. I appreciate it.
Okay, good.
And if I could add one last thing, because this has been a confusing area for a number of people looking at this. It's a non-cash thing that's being recorded right now. The intent on this by the Government Accounting Standards Board in establishing this is that governments, like private sector, have to show what their potential liability is in the future for pension payments. And when this was implemented, that was really the understanding, and the intent there was to reveal how much the county actually owes and the position that they're in as far as funding on those pensions. So these adjustments are made annually and reported to us late in the year, and we're completely at the mercy of the Wisconsin retirement system. So it's one of those things that because we're a participant, we have to report this.
Exactly. And back to, I said you had an unmodified opinion. That's part of it. You're following these standards. These standards are set for governments of all sizes across the United States. So you're following those standards. And as Keith said, it's a non-cash transaction or entry that needs to be made to follow those standards. And we did talk about it. It is relatively, It's available to us relatively late in the year, but we did talk about potentially trying to get that information to the county a little bit earlier once it is available from WRS. So if you're looking at your December information in January, February, it will already be updated for that potential piece and change. So again, it's not known that you would know throughout the year and could kind of put that impact across the whole year, but we would know it by the end of December. So we could get that information a little earlier so that you would know that potential impact earlier. And then as far as the change in net position, as I said, page 3 or the third page that I sent out, which has page 5 on the bottom, is a more detailed summary of that actual activity. So you'll see how your revenues increased. You provided more services to your residents, but then you'll see how some of the operating expenses increased as well. Most notably, the nursing services increased. And I know last year we talked about the pool and having to get those resources and from the pool, and that those costs had gone up. And obviously, if you're providing more services, those costs are going to increase as well. So, and then you'll see a couple others that I noted with some increases was therapy, dietary, and then employee benefits, some more notable increases. So, but then you'll see how that statement, as I said, is a more detailed statement to get down to that 1.5 million loss that we saw on the first page. But just a point of reference if you wanted a little more detail. And then the very last 3 pages of the summary I sent is even more detail of that statement, and it breaks it down by the 3 locations that you have: east, west, and central. So, and then back to the first page, we put the current ratio on there. So that's the line right above the graphs. And so what the current ratio is the current assets, your available cash, your current receivables, and those types of things, versus your current liabilities or payables that you have to make. And normally you'd want to see that at least a 1-to-1 ratio, that your current assets can pay for your current liabilities or higher. And you'll see that you're at 0.16 there. And so not much change in that the last few years as far as the percentage, but again, we'd like to see that higher. And that is a factor of that negative cash or that deficit cash that NDC has right now. So then we added in the graphs this year to kind of see where that total net position, as I said, that's accumulated losses over time, where you're at that -7 million. But then you'll see on the right-hand side, that graph shows that income loss from just your operations. So excluding your revenue or excluding your depreciation and interest expense and those changes in the pension and OPEB standard impacts. So you'll see that from operations, you have some positive results the last 5 years or so. But again, it's just that you are making those debt payments and you have depreciation on the assets that you have there. So those are the main talking points that I generally go over. And as I said, the next few pages are just more of the detailed information that's included in the financials that supports that high level summary that I just went over. Does anybody have any questions or?
Mr. Chairman, if I can ask a question? Okay, April, so I can understand the change in net position between reported in 18 and reported in 19 as largely being a consequence in the change in pension and OPEB. It's about $255,000, which equals basically the change in net position. The one that jumps out is the change in net position, however, at the bottom line between 17 and 18. And when I look at that, I note the change in the income from operations from 17, which was reported at 1.1 million, and 18, which was reported at 186. I understand that was a change in accounting practices that would account for that huge disparity between 17 and 18, but do you have any insight on that?
That was not necessarily a direct result of any change in accounting practice. Looking back at some of the details, I had just noted at that point in time, nursing services costs were a lot lower. So your expenses were lower there. And then some of the intergovernmental or your supplemental payment that you receive was a bit higher at that point in time. And maybe Carmen can speak a little bit more to this as to the specifics and the intricacies of that. But really from 17 to 18, expenses had increased quite significantly. Obviously your revenues had too, you were providing more services, but the expenses had increased quite significantly.
Thank you.
What? Oh, no, Brian, you're muted. So if you just, oh, okay.
We
Something
can see
happened.
you, Brian.
Yeah, we can see you. So I don't.
can't see you, so I don't know what you guys are thinking.
Okay.
What computer is he on?
He's on the furthest one back by the printer. What's the computer number? Training 12.
Okay. I will remote him.
Okay, Krista will help you out. Well, in the meantime, I can give a little bit of a update on the nursing services. So that April mentioned of pool staff, that has been our greatest expense. As she did mention, we have had increased revenue too, which would have been our increased census. So yes, pool staff is going up even more. The cost of pool staff is much more expensive than our own staff, and that's directly related to the overall industry nationwide shortage in nursing services, as there's just not enough people. And it does also increase the cost of services when we have a higher census. Things like April had mentioned outside of nursing services also do go up. The cost of food, the more people we have to feed, food costs go up. The more therapy we have, the therapy costs go up, especially since our censuses that were low in previous years were our rehab census. If you have all heard us talk about the central building had been the building that had the household closed, that would have opened in 2019, end of 2018, 2 months left of 18, but all of 19 that was open for the first year. And that also would increase our rehab census, which would be our therapy costs would go up due to our rehab census going up. It is not apples to apples to compare a resident that is in Central to a resident in East or West, as they are short-term rehab therapy. So our therapy goes up, but they also are reimbursed at a higher rate for the residents in Central. Medicare reimburses us at a much higher rate than both Medicaid or private pay residents. So that's some of the changes in that, a little bit more of a description off of what April had for an operating standpoint. Brian, are you back on now? You're still muted though.
There we go. You hear me now? Yeah. Okay. Are there any more questions? Any other questions for April? Hearing none, we'll move on to Carmen's Quality Assurance and Steering Committee update.
All right. So as always, we go over the Quality Assurance Steering Committee. We meet monthly to go over quality assurance metrics at the neighbors. We met last week. Again, we went over a lot about the current situation with COVID-19. That is a topic of most of our meetings right now, but we did discuss that and what our quality measures are for that going forward. I'll get more into detail later on in my report related to that. We also went over our safety committee report. We have a new person working for our life safety code. So it was his first report to the quality assurance committee. So he did well with that. And we're going over making sure we're staying on top of those as well, going through a transition. Life safety code is a very large project to work on. There's constantly things that need to be done, fire drills, checks of the sprinkler system, stuff like that, which has also been an added challenge with COVID-19. We had to come up with different ways to do a lot of those things because a lot of them require group gatherings. Something as simple as a fire drill typically gathers 20 some people in one place because we expect staff to respond to all alarms. So we've had to come up with different ways to make sure that everybody is following the proper procedures and that in a case of an actual fire, our staff know what to do. We also discussed our weather policy. We're getting to the time of severe weather. Severe thunderstorms and tornadoes are always our big topic throughout the summer. That's also different with COVID-19. Our typical response for severe weather is our residents would be brought out of their rooms into the corners of the households. That is the most structurally sound area in our buildings. But unfortunately, that means that they would have to be within 6 feet of each other. So we've had to come up with different ideas to make sure that they're protected from the most urgent danger. Also having our residents wear masks if they're out of their rooms and having to be in those smaller locations. But it's also looking at the risk of, yes, COVID-19 is a huge risk, but if we are having a tornado, that is the more urgent risk. So we've been working on that through the safety committee as well. Do you have any questions on quality assurance? Okay, then I'll move on to the employment activity report and I'll pass that over to Chris.
Okay, can everybody hear me?
Yes.
Okay. Sounds good. So our types of recruitment and referral sources have remained pretty steady. Last month, or for the month of May, we actually had 13 applications. We were able to schedule 7 interviews. Because of COVID, the CNA and LPN testing has been very hit and miss, and some of the CNA candidates are getting test sites in Milwaukee. As of right now, as of yesterday, or a couple weeks ago, I called in a favor from Dove Healthcare to see if we could have them test there, and they have let us. So we have a couple more coming, hopefully coming on board. But of the 7 interviews we had, we offered 7 positions. They were all accepted. There was one nurse that had requested higher. She kind of didn't like the wage that we had. I was able to offer. And so she requested higher, and we were able to hire her once that was approved. So with the 7 hires, you can see the number of resignations down here. So we've kind of some of the reasons: a full-time CNA took a janitorial job with Stout. We had a part-time RN who just stopped showing up. We had 3 part-time CNAs, kind of the end of the school year, end of college. So they were moving or going on to like an advanced program or something. We had 1 part-time CNA. She just chose not to come back from an educational leave. A part-time homemaker resigned on day 2 of orientation, just didn't feel she was a good fit, and she had some personal issues. And then we had a couple of part-time food service workers who one had moved and one had taken a different job and just were no longer available. So kind of goes down to look at the open positions. So those are adjusted accordingly due to our turnover and recruit or hiring. It's kind of slow right now for leaves of absence. I did miss one. There was a full-time CNA that's on a personal or on an FMLA. And if we go on to work comp hours, those had dipped significantly from April to only 38.75 lost hours. So we've had very little injury during that month and very little lost time for work comp. Does anybody have any questions on that, or?
Mr. Chair, may I have a
Yes,
question?
sir.
Mike?
Go ahead.
I don't know, this is for Chris or Carmen, but it relates to this. Do we have a lot of high school CNAs or students
Yes,
that work
we do.
there? How many?
1, 2, 3, 4, 5, 6, probably 6 that I can think of right off the top of my head.
And you just scheduled.
And I just scheduled 3 high school interviews, so potential of 9.
Okay, thank you.
Good.
Now, I have a question too, because I spoke with a CNA that just graduated from Menominee High School and worked at Colfax. And the reason she worked at Colfax was she said, I don't know if I got it right, but she said she received training at Menominee High School. And her clinical experience was in Colfax, so she just went to Colfax. So I'm wondering, do they have training in the high school that you're aware of? And do they come here for clinical training? Because, boy, that's a great way to get them. And I know Colfax had 6 high school seniors graduate from Menominee, Colfax nursing home. So, it, you know, that's our, other than taking care of the residents, the people that work for us, it's the next biggest thing we've got to deal with. So
we are actually pretty involved in the internship program through the Menominee High School. Menominee usually uses CVTC for their CNA class, and CVTC is weird how they choose like their. Paula can jump in here too. How they choose their clinical sites. It's one time it'll be us, and one time it'll be Colfax, and next time it'll be in Osseo or someplace weird like that. But
right, because we usually go through, or CVTC does come to us for their clinicals, but we have not had one for probably over a year.
mm-hmm.
So CVTC has both a CNA program and a nursing program. So we do have their clinicals for their nurses come to us frequently, several classes a year. The CNA program bounces around a little bit more. So that's through CVTC. But as Chris mentioned, they also have an internship program at Menominee High School. So it's basically a class that they take that is almost like work study. And then they have to report about working in the community back to their high school class. So they can do that at almost anywhere. I know some kids do it at McDonald's and some kids do it at different places. So we do have students through that that do their work study as part of working at the neighbors. So it's kind of like a class mixed with working as a CNA as well. So we do participate in that program.
So there's 2 different things we were talking about. The CVTC one that bounces around and they place the students in their clinicals.
Yep.
And then there's an internship program which isn't necessarily a CNA.
Yeah.
It's just,
well, it's CNAs, but it's CNAs that have already tested and passed. So they do it as part of their work study, but they're already CNAs before that starts.
Ah, okay. How young can they be to be trained for a CNA in high school?
Pollock.
16.
Okay, thank you.
So and another note on that, so they can be 16 to be a CNA. There are some tasks that CNAs do that they have to be 18 to do. So it's excellent to have them in the building to be able to do the tasks that they can, but we also run a risk when we have a lot of them because they cannot do some things. So we do have to schedule them with older staff members because they cannot operate any of the machinery. It's actually an OSHA regulation that they cannot operate machinery that lifts a human. It came from a forklift regulation actually, but it applies to our mechanical lifts that lift our residents up. So we have to have them work with older staff as well if they're under 18.
Dave?
Yeah, I thought a lot about this, and when you look at this chart and we've got 16 full-time CNA positions filled with agency, with the expense of the agency help, I brought up the CNN training that we used to do. We evidently can't get that going again because of teacher, but I think we have to concentrate on filling those CNA positions with people, employees from this area instead of agency help. Now, you know, we either have to pay enough to a teacher. That program seemed to work good when we had it going. Or we have to increase the pay on the CNAs to bring them to us. And we should be able to do that looking at what agency costs are. We're getting real close to the 1.5 million loss per year is basically what we bring in for extra revenue from the tax levy on the long-term debt for the neighbors. When we start getting over what that expense is, it's taking money from the rest of the county to keep the neighbors going. And then we're going to have to make a decision. I know years ago we said, well, we don't have to make a decision on keeping the neighbors because we're getting more in tax levy than what the expense is. And so we have more money to spend elsewhere in the county. Well, right now it's getting real close to being equal to that. And if it goes the other way, we're going to have to take money from highway or sheriff or someplace to keep the neighbors going. So I think we really have to figure out how to cut the expenses. It seems like when we talk about help from agency, we always automatically think of nursing, but in reality, we have one full-time RN and looks like 3 part-time LPNs and 3 part-time RNs filled with LPNs. The majority of it is CNAs. I think we should just concentrate on one level and try to fix that problem, whatever it is. But I think we really need to have some real discussions on where to go with this.
If I can, Mr. Chairman.
Sure, I agree.
So I completely agree with you, Chairman Bartlett. So, and you are correct. The CNAs is actually our biggest cost of those 3 things when we break down, and we'll see that later in the financial part, is that the biggest cost is the CNAs. It does outweigh the other 2. They are more, LPNs and RNs are more expensive per hour, but because we are using more hours of the CNAs, it is the biggest cost. Unfortunately, it is also the biggest number that we have. So we have 1 RN to 20 some residents. We have 2, or we have 1 CNA to 8. So we do need significantly more of them than we do the other 2 positions. But that is our biggest concern, is filling those positions. As you mentioned, having a class on site would be an option if we could find a teacher. So that is something that we could look into, of a cost study of how much it would cost to hire a nurse teacher. We can look into that and have that for the next meeting of what that might look like as a potential position and the cost of that position. I do not think that the reason for us having less is our wages for CNAs. In the market, we do have the highest wages for CNAs, simply because of our wage grid. Our wage grid starts at a higher level than most places have CNAs at. So the deterring factor of why they're potentially at other places, I don't believe that's the wages for the CNAs themselves. Looking at the wages for the RNs, to have someone be an RN teacher, that is something that we can do. But our wages right now for CNAs are actually significantly higher, especially our starting out. And then if they're part-time, our in lieu of fringe bumps them up even higher than that. And that's significantly more than what our competitors in our region are doing. I think part of it would be that the costs, or the kind of services that CNAs work in is we may not be losing CNAs to other nursing homes, is we're losing CNAs to other professions. If you look at our resignations, we had someone going to go clean at Stout. So they may be getting paid the same amount to do a less physically laborsome job and a less stressful job. So that is another thing. The one thing I can say that I'm hopeful for with our current situation with COVID-19, and everyone has talked about the economy, there's maybe more people that are going to want to stay in their CNA jobs because that is a consistent and secure job. It's one thing that's been shown throughout all of this. When people were out of work based on different jobs they had, no CNA was out of work. So that could be a benefit to our in the way of a market as well. But we are working on finding more CNAs. Some of the things that we typically do to find CNAs, such as job fairs and marketing pushes and stuff like that, we kind of can't do right now, but once we can, we will start that back up again. But the big one that I think we should look into is finding a nurse teacher to teach a class, because we could do that in our location. We just have to find a teacher. So we can work on what the wage for that would look like as based on what other nurse teachers are making in other locations.
Go ahead, Mike.
Thank you. Well, if money's not the problem, then I think you need to look at the other kinds of things that affect people, whether it's scheduling or the work atmosphere or whatever. It's not a pleasant thing to look in yourself, but maybe some changes need to be made there because it's not working and money isn't the answer. So one of the solutions I know Dave brought up, I think that's a great idea. We've talked about it in the past, but maybe some out of the box or some soul searching on some other kinds of changes. Thank you.
Carmen, do you believe that there's other facilities in the area that are using a lot of pool help for CNAs? That's the case?
Yes. That is across the board. Everywhere is using pool help. I do know that when we first started, for example, the COVID-19 situation, we had to make sure that our staff were working in other nursing homes. And we had looked into the pool help because we did know that the other nursing home in town, Menominee, had some of the exact same pool staff that we had. So we had to talk to people about staying in one building. So I do know the other skilled nursing facilities are also using extensive amounts of pool help.
Okay, thank you.
Mm-hmm. Does anyone have any other questions about employment? I think.
Steve? Supervisor Jensen, go ahead. You're muted. You had your hand up? Go ahead, Supervisor Jensen. You're muted. There you go.
I was wondering if we hire a teacher to educate these CNNs, is there a guarantee that they stay at the neighbors, or will they move on after Dunn County has paid the expense of educating them?
Sure. There isn't a guarantee that they'd stay with us, but it is typical that they do because that's where they know. It does also get them how the clinicals work is they actually work on the floor. So it also would be helpful to have more staff on the floor with our staff. But then on top of that, they get used to the situation that is there. So yes, we'd have some people that would probably come from further away that would find a job closer to home. But typically people stay for at least a little bit where they train because it's easier because they know the facility, they know the residents, stuff like that. So it does bring in some, but no, there's no guarantee that everybody would stay.
Okay, thank you.
Mm-hmm.
Yep. Anybody else? Any other questions? Go ahead, Carmen.
Okay. So the next thing on the agenda is the resident referral report. So that is on the back of the last report. The number of residents in the facility on the first of the month was 121. So if you remember, that is our budgeted census. So even though we have seen a bit of a dip due to COVID-19 and having less elective surgeries, we are staying around our budgeted census for the year. We had 36 referrals. That's a little bit higher than last month, but still quite significantly low for us. Previous to COVID-19, probably back in February or March, we were seeing in the 70s and 80s for referrals. So we're significantly down. We had 16 residents admitted during the month of May, and we had 20 residents that weren't admitted. The list below is the reasons why. We had 8 that went home. That has been the preference for a lot of people during this time. That number is high. Skilled nursing facilities and other congregate living facilities are a dangerous place right now. So if people can go home, they are, because the risk of spread of the infectious disease is much higher in a congregate living location. So if they can, people are really encouraging them to go home, which is safer. So we had a significant amount of people go home. There's one person who passed away at the hospital. We had 4 that went to their first choice. 3 were swing beds, so those are skilled nursing beds that are in the hospital. And then 1 went to Asota Healthcare. And then we had 1 that was out of network insurance. We had 4 with severe behavioral issues or drug issues. We had 1 that we couldn't meet their needs and 1 that was bariatric. At the end of the month, we had number of residents at the end of the month was 128. So we did go up in residents at the end of the month. And then we had no residents go to another facility. We had 2 deaths, and then we had 7 people discharge home. Our referral sources were the same as normal: Eau Claire, Menominee, and Rochester. We have been seeing a lot less referrals from all 3, as well as less referrals from other ancillary hospitals that we maybe get 1 or 2 a month. We haven't hardly seen any from those because they have less residents or patients in the hospital as well. We have seen the surgeries pick up this month. So I think next month's report, we will see a higher number of referrals. We have had more admissions and more surgeries that were either planned or they would like to go to a skilled nursing facility. So I do perceive that number going up in the future because they are starting to do surgeries again at our local hospital. And that is where we get most of our referrals from. Does anyone have any questions on the referral or admission activity? Okay, and I will then move on to the environmental and facilities report. So I'll hand it over to Scott.
All right. Last meeting I reported that Josh Delaney had taken over for Bill Harmon as facility technician. I just wanted to report that he's doing a very good job getting his feet wet with everything and learning all the things that Bill did. Working alongside with Ricky Hansen as our facilities worker. They are making a great team. The dynamic between them is very good. Getting along very well and getting the jobs done. So that is working out well. We have placed a couple of stop signs in front of the neighbor's building so that when you come to the neighbors in person for the first time, you'll find that as you're coming toward the neighbor's buildings from 12 and 29, the two-way stop sign intersection has now become a 4-way stop sign intersection, so that if you are coming from Central Building, you now have to stop before making your right-hand turn to go out toward 12 and 29. And if you're coming from the Community Services Building toward the neighbors' buildings, you also have to stop before taking your left to head toward 12 and 29. This is in an attempt to slow down traffic, make things safer. Has been discussed for quite some time with the safety committee. It got done this week, so it's hopefully should be slowing people down. As far as the grounds, I've had my seasonal guys help out when they get a chance with doing some of the flower gardens, a cleanup of weeds and that, to get things looking better for the residents that are stuck inside. Looking out a window at a flower garden looks much better when there's less weeds in there. So we've been doing some cleanup on the grounds, get things looking better. Aside from that, it's pretty much been business as usual, taking care of work orders and little issues that have came up, but nothing serious. Any questions?
Hearing none. Thanks, Scott.
Thank you.
All right, the next topic on my report is the one I'm sure we've heard way more than we would like to, but is COVID-19. So as Supervisor Johnson talked about last night at the county board meeting, the neighbors is still in full COVID-19 restrictions, and we will be for quite some time. CMS, the Centers for Medicare and Medicaid Services, which is our regulatory body, did come out with a plan to reopen nursing homes. And this is a national plan. So it doesn't specifically talk about any specific location or when this should be implemented. It is a general gist of what they think that it'll look like when we start to reopen nursing homes and how we should do that. On the Wisconsin specific calls, they are very clear that we are nowhere near starting to reopen. It has very little to do with what's actually going on inside the nursing home. It has much more to do what's going on in the community. If you look at it as the nursing home is there and we're trying to put a bubble around us, to be honest. We house the most vulnerable people that there are, and we are trying to make sure that the illness does not get into our little bubble. So what's going around in the community is what's going to affect what happens with us, and that's where that 3-step process that CMS has put out starts. On the DHS and DQA, which is the local regulatory body through the state of Wisconsin, on their weekly calls, they are very clear that we are not moving past step 1 yet. So that means staying in the restrictions that we have, which, yes, are very hard for both staff, residents, and their families, but very necessary to make sure that we keep those residents safe. It has been a long haul so far, and it's going to continue. Unfortunately, it means that our visitation policy has stayed the same, which is hard on our families and our residents, but it is also hard to think about the risk of letting an illness that could kill people into our facilities. So we are still following what DHS and DQA is saying, as well as CMS's restrictions, to the strictest ability that we can to make sure that we protect our residents. There's also been changes and re-guidance on some of the different protocols that we've had related to PPE usage, as well as you can see behind Chris and Paula is our large stockpile of PPE. That is our neighbor's boardroom has been converted into our PPE central hub. It basically has all the things that we have in there that have either been purchased by us, donated, or that have been allocated from FEMA or the state of Wisconsin. So that has all the things that we need in the case that we have a resident that has COVID-19 or an outbreak in our facility. It also holds the things that we need for general usage due to changes in PPE usage of COVID-19. One of those is for new admissions. When we have a resident admitted to the neighbors for 14 days, we have to use full PPE COVID-19 precautions with that resident. So that means when someone goes into that room to take care of that resident, they have to gown up, glove up, N95 mask, and a face shield. So that is a huge usage of PPE. We're trying to be as conservative as possible with that usage, limit amount of times into the room, reuse what we can reuse, such as the face shields can be wiped down, N95s can be sanitized through the public health system, and reuse as much as possible so we don't run out. We're keeping a very close eye on the amount that we have. It is all organized in that room to be the specific things, or with each pile is a specific thing, to make sure that we're not running out of one thing or another, and very cautious of what we're ordering as well. On that note of ordering, is the cost of these items has severely increased due to supply and demand. Some of the items that were previously available are not available anymore, replaced with a more expensive item. Masks were one of those things that went from about $3 a box to $25 a box. So it's been a very eye-opening experience of how much things cost and how much we need. We go through a lot of supplies in an average day, just to take care of the residents, and to make sure that we aren't spreading something if a resident does have COVID-19 or any other infectious disease for that matter. So far, we have not had any cases at the neighbors in either staff or residents. I know that was reported last night, but that has not changed. We did receive all of our tests back that we had taken, that were negative tests. There has been discussion about how to go forward with testing. It is great that we had negative tests, but all those tell us is that on the day that those swabs were taken, the person was negative. So within an hour after that, that could change. Actually 10 minutes after that, that could change. If they left the building, went to the grocery store, talked to someone for 10 minutes, that their status of COVID-19 could change. So it is a great starting point, but it doesn't really tell us what our current situation is, especially since the delay in getting those results were several days. The state of Wisconsin has discussed how they want nursing homes to continue testing. They have not put out clear guidance on it yet. When this all first started, they said every 2 weeks. Unfortunately, that's slightly unrealistic because it took us almost 2 weeks to test and over 2 weeks to get the results all back. So we would be constantly testing, and that takes up a lot of staff time and effort, as well as the labs just can't handle that much. It took them a long time to get us our test results back. So they haven't come up with clear guidance on that. I do know that other states that have done this have done even stricter things. I know Dr. Brown has talked about New York had a goal to have the staff and residents of nursing homes tested twice a week, which just seems even more crazy. But unfortunately, we don't have a clear plan or guidance on that yet. But we do foresee testing more going forward, as that only gave us a small snapshot of what's going on. So we will probably see more testing going forward. The funding for that testing is all coming from the state, so we do not pay for that testing, and we can receive as many test kits as we would like through the end of the year. It is part of the emergency order, which extends, and the CARES Act, which extends through the end of 2020. Does anyone have any questions specific to COVID-19 for me? I know that's a lot of information.
I do, Carmen.
Sure.
It's all volunteer testing, correct?
Yes. So we are not, so the state of Wisconsin put this out there as a voluntary program. We are not required by the state of Wisconsin to do this. Some nursing homes did not. We did choose to do it. It's for the safety of our residents. Part of the reasoning to not do it, which other nursing homes have decided to do, was if we do have a positive case, say we had a staff member that was positive, say it was someone that worked in an office that had no resident contact, they were maintaining 6-foot distancing from everybody, had very little risk of infecting somebody. And they tested positive, they were asymptomatic, had no idea they were sick, didn't get anyone else sick. We would then be put on a list that says we are a positive facility. which is posted on the internet. So every skilled nursing facility that has a positive case in either staff or residents is posted online for the public to see, even if it didn't spread. So, and that is very unique for our industry. For any other industry, you have to have 2 cases. So say the meat packing industry, if you have 1 case and you did not allow it to spread, you were monitoring appropriately, and it didn't spread past the 1 staff member, then you're not posted online. Ours is 1 case, even if we handle it properly. Say we screen someone because we're screening all staff every day. Say I get my temperature checked in the morning, it's 100.1 or 101 degrees. I go into the doctor, I have my COVID-19 test taken, and I am positive, even though I didn't infect a single resident or another staff member, we are considered an infected positive facility according to the state and on the website. So that is a negative connotation to the nursing home. So there was some facilities that chose not to, because it was basically volunteering yourself to be put on the publicly broadcasted list of facilities with COVID-19. We weighed that decision and decided that it was better to take the safety of our residents over the potential poor PR of having a positive case, to make sure that we were testing to see if anybody had it. And we are very fortunate that we didn't. On top of that, it is also voluntary for the actual individuals to be tested. We did have a couple of residents that refused, either their powers of attorney refused or the residents themselves. The majority of those were people who had severe dementia. We had 1 POA that refused due to they didn't think we'd be able to get the sample. And then we had a resident not verbally refuse, but basically pushed the staff member away and said absolutely not. So we did have a couple of refusals, but with the mass majority of our staff and residents being tested, all coming back negative, it is unlikely that the people who refused were positive, as they would have had to get it from somewhere. And with all the staff being negative, it is very unlikely that those couple of residents would be positive.
Okay, thank you.
Any other questions about COVID? All right. I will move on to the next item, which is also related to COVID, which is survey activity. Normally I report survey activity when we have a survey. We have not had one yet, but we will be having one in each building before the end of next month. It is a White House task force initiative to have infection control specific surveys, or Icar surveys, in every skilled nursing facility in the country before July 31st. So our surveyors are having a challenge on their hands as well, because that's a lot of nursing homes. The state of Wisconsin has almost 400 nursing homes, and they all need to be surveyed within a month and a half. This came out earlier this month, so it's a lot of work for them as well. If the surveys are not completed, the surveyors themselves could be fined, as well as decertified from the survey process. So there's a lot of pressure on them at this point, but they will come in to do an infection control survey. From my counterparts at other locations that have already had theirs, they are very brief. They call first in most situations. About a day before, they give you a call. They do most of the survey over the phone and email. They ask for a lot of paperwork, our policies, our procedures, our logs, any kind of documentation related to how we are responding to the current pandemic situation and what we are doing to prevent the spread in the nursing home. We send all of that to them electronically, and then typically the following day or a few days after that, they come into the building and do an on-site survey. It is kind of counterproductive to what we've been talking about not letting people into the nursing homes, as well as not letting people who have been in other nursing homes in, but they are considered essential healthcare workers. We will screen them at the door. That is actually part of the test of the survey, is to make sure that we're screening everyone that comes in. So all of our staff know to screen the surveyors when they come in. And then they were in the building for less than a day, typically, unless they find a significant issue with your infection control process. They're only there to survey infection control. They do not do a full annual survey. Even though one of our buildings is technically in their survey window, they're only there to do infection control. So they go based on what they looked at on the policies and procedures, and then they walk around. Most of the buildings that have had their infection control surveys already say it's about an hour. They walk around, make sure that people are doing proper hand washing. They ask staff about our COVID-19 policies. They watch staff don and doff PPE to make sure they're doing that appropriately. And then they have a small exit meeting and hopefully do not cite any citations. Most of the people who have had their surveys already have said they're very brief. They're very smooth. The surveyors also, they're not coming in to cite every single thing unless you have an egregious situation, because they just want to make sure that we're ready in case we have an infected person. They are starting with the people who have had cases. And if you have a new case, they basically said expect your infection control survey the next day. So the buildings that are having new cases are starting to get their surveys, but they're also trying to do all the other buildings as well at the same time. I do know one of our other facilities in our county has had their survey or did have their survey this week. So I don't know how they're doing it, if it's alphabetical or if it's in regional order or what it might be, but they were in town this week. Does anybody have any questions about the Icar surveys? I will also add that I don't know if they're going to do all three of ours at the same time, or if we will have three separate surveys. As you all know, typically our surveys are done independently of each other, which is by design, because they all are separate license, and it would be a lot to have them all at the same time. But for this situation, I don't know if they might do them or all together, since our policies and our procedures are the same for every building. That would be beneficial to us if they did that, but I don't know if that is the case or not. Any questions on surveys? Okay. The next item that I will go over is the relief and grant funding. I sent all of you an email about this when we did receive this money. It was a large sum of money that was sent directly to us. We did receive it. The following day, we did get an email that came with the restrictions of the grant money, which was a nice catch afterwards. So we did have restrictions to this money, and we're working through how we could allocate it to different fundings or different reasons. It does have to do with COVID-19. So it cannot just go into general operations, which is kind of how it was originally worded. It was just basically, we got a check for a bunch of money. And then we got an email saying that this is specific relief funding for COVID-19, and it needs to be applied to COVID-19 expenses. So we are working through what we can qualify and quantify as COVID-19 expenses of things that have increased since we have started to buy different things due to COVID-19, like the stockpile behind Chris and Paula, different amounts of costs of staff time for COVID-19, things like that. As we're going through a lot of it, unfortunately, for example, the staff time, it has increased hours for many people. Unfortunately, the majority of those people are salaried, so it doesn't increase dollars. But we are looking into how we can craftily put that into things that have gone up due to COVID. So we are working on that, and I believe next month we'll probably have a more detailed report about that. But we are working through what we could do with that money so that we can keep as much of those funds as possible. The return policy of the funds is also another question of they just sent it to us versus asking us how much that we could quantify as being COVID-19. So we're working through all of that, and we'll have a more detailed response next month for that.
I'm sure you can find somewhere to spend it.
Yes. We're doing our best to figure out how much of things we can actually allocate and say this was due to COVID-19. And we've also looked down the lost revenue side of this, of what we could say we actually lost due to COVID-19. As you've all heard my referral report last month and this month, we have lost census due to COVID-19. Now the trick is proving that that had something to do with it, looking at trends, going through that. The unfortunate part of this is this year was doing really well. Historically, if you go back and we're looking at year to year, we're not too far off of our normal census from the last couple of years with COVID-19 census. So we're looking at how we can prove that that is a dip. We were up in the 130s, if you all remember, for quite some time. So it is a very obvious dip right after this happened, but making sure that we can quantify that as being related to COVID-19 without having to compare it to previous years, because we do look very similar to previous years at this time. So we're working through that, and we'll have more information for you next month on that. Any questions on the grant funding? Supervisor McCullough?
Yeah, just a quick note. I know that when we were doing stuff with the Historical Society where we were trying to allocate extra funds for salary employees, what we did is we prorated. So we said this percentage of their salary is going to this project.
Okay.
So that's one way to possibly approach that.
Okay. Thank you for that. I'll talk with Keith about that and see if that's something that we can do. Any other questions or comments on the grant relief funding? Okay. I also do, on that note, we did receive another grant that we're working through. That's not a direct money grant, but it's a technology grant. So CPM money is the funds that are taken from facilities when they get cited for large citations, such as immediate jeopardies, and then they are fined for those immediate jeopardies. That money is then put into basically a bank account that is called CPM money, and then that is given out to facilities that do well in things, and then is also used for things as grants. So we have received acceptance of our grant application for CPM money to have technology for residents. So that is something that came out as visitations are limited. It was a grant that was put out that we applied for each building. It was up to $3,000 for each facility to buy technology for residents so that they are able to communicate with their loved ones. So we did apply for this. We did receive this. We are now working with IT on how to order their kinds of technology so that they can also work on it. Because when we order things that aren't necessarily bought through IT, it makes things a little bit more difficult for if something breaks or we have technical difficulties, as a lot of us have, especially right now as we're trying to learn new things. So we are working on getting 9 Chromebooks, which are the little computer tablet mixtures that we currently use in our nurses' stations for our med carts. We are going to get one for each household, so that each household has one that they can use to do video conferences with the residents and their families. Right now, we have a couple different computers and iPads that were either donated or that we already had that we've been using. but it's made it really difficult to run around and schedule. And when one person in West wants to talk with their family at 2 p.m. on Friday and someone in East wants to talk with their family at 2:15 on Friday, poor Sally from Life Enrichment is sprinting across campus to get the laptop over there. So now we will have one for each household. And then that way our staff can be trained so that CNAs and nurses and homemakers can help with those conference calls, so that our activities staff is not having to run around and do it. As well as we would get one large iPad for each household or each neighborhood that could be used for bigger conference calls and things like that. This also could help us with some of our budgeting process for next year, as we were planning on replacing our den computers for our residents. And that would be computers that they use. If we do get the 9 Chromebooks and we were actually planning on replacing them with Chromebooks with monitors. So we would only have to replace the monitors because we will be getting 9 Chromebooks. So we probably wouldn't need 2 resident computers in each household. So we would use these for that, and that would meet both functions. So once we get those in, that could adjust our budget for next year for IT, which is very nice too. Any questions about the CPM grants? Okay. I will move on to census and case mix. So as usual, we report census every month. So census was down this past month. It was at 121. So that is right on budget. So previously throughout the year, we have been above budget every month. But even through our shortened census during COVID-19, we are staying right at budget. So we're happy about that. It's not as great as seeing the 130s and up, but we are staying at our budgeted number, which was 88%, 121, even through this dip. So we're hoping to continue that, as well as see it increase in the next couple months as things start to pick up again. Any question on census? Okay, and that concludes my report that I had on here. Does anyone else have any other questions for me?
Mike. Supervisor Kinnear.
Thank you. Thank you. I was wondering, we've gotten reports in the past with the bar graph showing Medicare, Medicaid, et cetera, and an aging thing. I don't know if I missed that in the packet, or it'd be nice to have that. What was it in the packet?
I believe it was in Jane's report of her packet. Let me just get back there. Unless something got mis-emailed. It was in, so the back.
Got emailed out yesterday.
This.
Show me that again, Brian.
It's behind the audit. It's after the audit in the packet.
Oh, okay. I just missed it. Then I didn't see the bar graph or anything. Thank you.
So we have gotten, so once we jump into financial reports in a minute, we have gotten more on track with getting more of the financial reports out there that we had previously done. Jane and Keith have worked on that and gotten back to what we have been trying to do. There are some things that may look a little bit different that Jane has put together, kind of a different view of what's going on, but they will cover all of the same topics. So, any other questions for me?
Well, I guess I do kind of one for Chair Bartlett. We evidently didn't buy a bus.
After Commissioner Sporsky talked with the mechanics that worked on it, he, in his opinion, it didn't pay to buy one of those buses. They all seem to have something major with them.
Yeah, that's what I saw too. I don't imagine you're running anything anyway right now, are you, Carmen? No.
We are not. So we have not run any buses lately because we do not have any of our outings going on. And to be honest, I don't know when those would start up again. That's going to start when visitation starts probably. So that could be a while still. Our bus has actually been sitting over here at the Community Services Building parking lot, as well as the bus that we have typically been using, which has been one of the newer county buses that has a wheelchair accessible unit in it. We have been using that, and that also has been staying in its parked location. So
Okay. Well, on a normal year, do you need two?
it depends on the capacity of it. So we have been using, we did use our bus and a van before. So our big bus is the one that has a lot of the issues that is unsafe. We still can use our van. So our van only holds a couple of wheelchair seats in it, and it doesn't have as much seating for non-wheelchair seats. But our bus is the one that holds a lot of people in it. So we've typically taken both to bigger outings, like the senior center on Wednesdays. Almost all of our residents want to go to that. So there's differing times based on what the activity is of how many residents want to go. So we do have a van. The thing that we're currently missing is a large bus. So we do have a way to get a couple of residents somewhere, but we don't have a way to get a large group of people somewhere, which we used to with our bus. It's just not really safe at this point,
Okay.
to be honest.
All right. Thank you.
Mhm.
Are there any other questions for Ms. Flunker and her report? On her report. And hearing none, I'm sure everyone had a chance to review the vouchers. Anybody have any questions? Anything you want to talk about, pull out, or? And hearing none, we'll go to the financial report. Oh, I'm sorry. Got to be quicker, Dave. Chairman Bartlett, you're muted.
I forget that. I'm sorry. Just curious, under buildings and repair, there's a company called the Glacier Group, and we do quite a bit of work with them, or we buy quite a bit of stuff. I was just wondering what that company is.
If Scott's still on the line, can you address that?
I'm here. That would be for the heat pumps.
Okay.
That's where we order heat pumps from.
I was wondering that. Okay,
Yep.
Thank you.
Yep, you're welcome.
And we did have a heat pump that was replaced that we found out had a different issue with the routing of something in the pipes. I am not the heat pump technician, but there was an issue with what was going on with it that we ended up not needing the heat pump. So we have worked on either returning or figuring out where else it could be used or stored until the time that another one needs to be replaced. So I know Josh was working on that because it actually never came out of the box because we figured out there was another issue. So we've been working with a company on that.
Supervisor Jensen.
Yes, going back to the buses.
Yes.
I was wondering if it's in good shape with bad weather approaching, that it's ready to go if it had to be used.
Our current bus?
Yeah.
Yeah, so our current bus is in fairly rough shape. It is usable. It just has significant issues with it. I know it had issues with the mirrors at one point recently. I think last year we had issues with the AC in it and the heating in it. It has had significant amount of work on it. It is usable. And I know it's currently, if we were to start it up, we hope it would start. It hasn't been touched in quite some time, but it is usable. It was being used up until the point that activities had to stop. It's just not in the best condition. So that's why almost every year we discuss it as being an item that we would like to buy as a capital purchase. But with our current financial situation, we have not been able to do so. We have worked on other ways to purchase a bus. We've looked at a couple of grants. Unfortunately, we were not able to apply for the grants because we didn't meet the right criteria for them. We found one that was a transportation of elderly grant, but unfortunately that was only in the community. It didn't work for a setting such as ours. So we are working on doing potential things like fundraising. We actually had a full summer planned of different fundraising events that we have had to cancel due to this current situation. So we will pick those back up once we can have them, but they did involve bringing large groups of people into the neighbors, so we can't do those right now. So it is something that we're working on, and hopefully next year after all of this clears up, we can start fundraising again and potentially get a bus that way as well.
Yeah, I was just concerned about bad weather and having a bus to transport.
Yeah,
if need to be.
it does make it through if need to be. If we do have bad weather in a case of an emergency where we'd have to transport people out, we do have contracted services for that with the ambulance services, the school bus services, things like that. In the case of like a natural emergency, if we had to transport residents to another facility, and we also have contracts with other facilities that are at a max or a minimum of 50 miles away from us, which is a federal regulation. So we would transport people to those facilities if need be through our contracted transport services during those times.
Okay, thank you.
Mhm.
Chairman Bartley, you had your hand up?
Yeah, I was just wondering if I've been told, I don't remember. How many miles and what year is this bus?
Scott, do you know the specifics on that? I'm not 100% sure.
Dave, I'm not exactly sure the current mileage, but the bus is a 99. 99 or 2000 right in there. It was, I know I started with Dunn County Healthcare Center in 2000, and it was a brand new bus there. So it's either a 99 or a 2000 model. But like I say, I'm unsure of the exact mileage at this point.
What's the capacity?
Is that is a 12 passenger?
12.
Mm-hmm.
I can get you the mileage, Dave.
Yeah, we can find the mileage for that. I know Sally keeps track of that from Life Enrichment, so I'm sure she has it, so I can send you that.
Okay, are there any other questions on that order or anything on the vouchers? Anybody have any other questions? If not, we'll go into the financial report.
Okay, I'm Jane, second month in a row here. Does everybody have a copy of the income statements that were sent out? Yep, okay. So when we go through the revenues, let's start right at the top. The Medicaid revenues are above what we projected. On the other hand, the private pay is not. So we're kind of getting more Medicaid, less private pay, and the revenue in the end per day will be reduced slightly because of that. In April, our Medicare A census was down. It's climbing a little bit now, but that's a place where we can show due to COVID, our usual amounts of Medicare days are this, and in April it really tanked. So I feel confident we can recapture some of that through the COVID coding and investigation. VA is pretty stable. I know we projected that we'd have more VA this year, and we certainly are. So that's on a good track. We're receiving our supplemental payments from Medicaid just fine. The bistro revenue is at 0. Senior meals are increased. The usage is increased, and then of course you'll see the food expense is a little bit higher because we're serving more people.
Jane, if I could for 1 second on that. I know it's been a topic that we have talked about at great length in the past between the bistro and senior meals about looking at if it's actually making money. So we did cost those two out for the year so far. I did senior meals for the month and then the bistro for the year since we haven't had the bistro open for a couple of months. But they both are making money. So even if we see that they have below budgeted numbers, but then their expenses are below too. So for the month, senior meals made a profit of just not shy of $2,000. It was $1,999. And then for the year so far, the bistro has made a profit of $2,568. So those measures that we had talked about in the past of increasing the cost of the meals and more making it more of what you're serving is what you're paying for instead of $5 for everything has actually paid off. And we have seen an increase in our income from both the bistro services and then senior meals. We did do an increase in our cost per meal that was backdated to January. So we did see an increase in that. We did a restudy of how much money that we're spending on the meals as well as staffing for that. So we have seen an increase in our revenue from both of those services. Go ahead, Jane.
Okay, any question on the revenues then? Okay, on the expenses, administration, you'll see has a negative $56,000 in there in variance. That is due to some write-offs. When we have to write off revenue, it goes to the administration account. So you'll see that little bit of variance in there as we go on this year. Nursing services does include the pool staff, and the year-to-date variance is $230,000. And we discussed the pool staff at length.
I could jump in there again too. Sorry, Jane. So the pool staff that we have talked about ongoing for quite some time now, the $230,000 that are currently in that bucket is a significant decrease from previous years. I don't have the exact number from last year at this time, but we have seen a lot higher numbers. It was almost that high per month as what we were over at one point. So we have seen a decrease in that, and that's due to a couple different things. We have change in our scheduler. Our current scheduler is working really hard to fill open shifts with our own staff instead of having pool staff fill those open shifts, which has decreased our number of pool hours. Even if we still have the same amount of pool staff, if they're working less overtime, that drops the cost way down. So if they're working just their straight pool full-time hours, that's expensive enough as it is, but now we're trying to limit their overtime hours and fill overtime with our own staff to help fill those unfilled positions. So she's been working very hard at that, as well as since the COVID-19 pandemic, and we were worried about staffing shortages if people got sick. We changed our pickup pay. So basically when someone picks up a shift, before it was 72 hours before the shift started, they had to pick up the shift that early to get the incentive pay to do so. We changed that to 24 hours before. So now if someone picks up a shift for tomorrow, they can get incentive pay. So that has increased the incentive for our own staff to pick up shifts instead of having to rely on agency last minute to fill those. So we're doing a couple of different internal checks to help limit the pool staff. And even though it is still over in nursing budget, it is significantly less over than it has been in the past due to some of those changes.
Okay, and also to note with the COVID coding of expenses, if we're going to look at what percentage of the labor time is spent on COVID related duties, we haven't coded any of the expenses out of here yet. That'll be our project for this next month, is to really review the expenses and say, this was COVID expense, we have to move it out of our regular operations accounts. So we would see a little bit of change as the months go on here too, with those COVID expenses being reclassified. MDS has some reclassifications to do. Carmen and I looked at those yesterday. Physician fees are right on. Pharmacy is good. In general, it goes pretty well until you get down to property ownership. And that has to do with the accruals, which I just reviewed yesterday, and that's after this has gone, the reports have gone out. Some of our things that we usually accrue and spread out those expenses over 12 months have been paid up front. So some of our insurances, charges for bigger items that we would spread out over the years has been paid up front. So we'll reconcile that for the next month coming up. As you notice at the bottom, there is no accrual this month. As we have prepaid those already, we don't need to accrue them again unless we juggle the funds. But that's the gist of why we're a little bit off on some of these because of the accruals. I'll reconcile that for next month. Housekeeping is low. I think that maybe, Scott, if you've already done some COVID expensing, that might be why the expenses are a little bit lower there. That's what I have for that sheet. Do you have any questions? We did have a little bit of a profit this month. When you look at the month to month revenues to expenses, it didn't look too bad. So okay, accounts receivable. Did you all receive a sheet that looks, well, we've got two. One looks like this, the month to month one over the whole year, and then we've got the detail. I don't know if you look at this one, the legal size sheet. So if we start with the accounts receivable aging analysis, it does go back 1 year, and the columns are, we've got the within the column, the 31 to 60 days, and then down to the over 1 year old claims. And when you look from January, if you go back to January 23, it was starting to get higher there. Well, December, basically when Leah left, she was doing some of the higher dollar billing for Medicare and VA and the insurances. So the aging started going up at that point. And now in April, it went down a little bit, and in May it went down again. So you can see how staffing affects our ability to collect the money. I anticipate that to keep going down. There'll be some write-offs, but we're collecting more money on the collectible billing. So that's the good news within that. Although it's not a pretty number, but we are working on it. The board asked for the next sheet, the detail of, is it VA, is it Medicare, what pay sources make up that huge amount that we're working on. And I guess the takeaway from the larger sheet is if you go down to like the Medicare Part A total, that's very manageable. The Part Bs are manageable. Some of those Medicaid dollars are related to the other, like a Medicare claim. So it's the co-insurance that matches another claim that maybe hasn't paid yet. The ones that of most concern, I think, are the like Medicare Part A, the like Medicare Part B. Those are those HMOs. They have special billing rules, timely filing issues, and those are a little tougher nut to crack. And then the private pay total at the very, very bottom. We're doing some cleanup that was needed to be done probably from over a year ago. It was just residual, some divestments, some just uncollectibles, and then the ones that we are collecting on, some are on payment pay schedules. So they pay a little bit every month. So Not to say that it's non-collectible, but I think it's manageable and we're making progress. I know this past month I've worked real hard on getting the audit done, and the cost reports, the 3 cost reports for Medicaid are submitted to Clifton Larson for review. They haven't been submitted to Medicaid yet or Medicare, but they're pretty much formatted, and the heavy work on our end is done. So now I will continue to train our new staff person who is still in training, but doing very well on her tasks, and really knuckle down on the aging. Any questions on the aging? Okay.
Do you have anything else, Jane? Or?
I don't have anything else. I guess this next month I'll be working with Carmen on the COVID, reclassifying some expenses and getting a spreadsheet ready, and that would be for all of DHS. I think there's a lot of different money that has come in. It's been, or will be posted to the COVID money. Now we have to balance that out with the expenses and get that formatted so board supervisors can see where and how it's being distributed.
Thank you. Anybody have any questions for Jane? And hearing none, is there a motion to approve the vouchers and the financial report? Kelly,
I'll move.
Kelly moves, Mike second. You good with the second, Mike? Any other questions or discussion? Hearing none, all those in favor say aye of approving.
Aye.
Aye.
Against, same sign.
Aye.
Carry. You were for or against, Steve? I'm sorry, I was a little slow.
Aye. 4.
Okay. All right.
Thank you.
All right. The vouchers and financial reports are approved. Does anyone have anything else? And hearing none, Chris, our next meeting will be July 16th. Is that correct? Or am I off a week?
Nope, you're correct. That's right.
Okay.
16th of July.
Probably will be another Zoom meeting. So if nobody has anything else, we are adjourned. Thank you.
Have a good day.
So long, folks.
Bye all.
Thank you.
If you want to stop the live